Invariably, I'm just taking it out, sorry.
No problem.
Invariably, almost, it's fashion. Invariably, almost always. All right? In almost every case of a shoulder condition, rotator cuff condition, certainly where there is impingement involved, the middle scalene muscle on that same side, which goes from the TVPs of T2 to 6 over to the first rib, down to the first rib, is contracted.
Donc, dans la plupart des cas de syndrome d'accrochage, ou un peu comme d'épaule barrée comme ça, le scalène du milieu va être trop contracté, va être short.
C'est mon cas.
So, how do we check that? We use basically one finger. We rest on the shoulder over the acromion, and with one finger we just tilt the head, and it'll stop by itself. And then we'll take a look at the other side and do the same. In his case, there's not a lot of discrepancy really, but there is a little bit. He's a little bit shorter on the left side, okay? And one of the things that you'll always do with these patients is when they're in that position is you'll come in and you'll sort of grab it and feel it and they'll say, ah, that's tender. So he's tender on both sides, but he's more tender on the left side. So it's a good idea for me, because I can feel it really getting tender all the way down to the first rib. It's a good idea for me to decompress this, to elongate that middle scalene. Why? When the middle scalene pulls up in the first rib, what structures travel between, anybody have any idea?
Plexus brachial.
The brachial plexus exactly travels between the middle scalene and the first rib. Goes right through the center.
Plexus
Just hold your, put your hand through there.
Here.
So the brachial plexus goes through here, and when this contracts, the first rib comes up and this closes off, causing compression of the nerves that go through that thoracic outlet into the shoulder, down into the arm. So we don't want that, right? And so we want to elongate that middle scalene to decompress the nerves and the brachial plexus going through to the shoulder.
Donc, pour les francophones, le plexus brachial passe entre le scalène et la première côte. Puis souvent, quand le scalène est coincé, ça va venir coincer un petit peu le nerf, ça peut donner des symptômes d'engourdissement. Donc, c'est une des raisons pourquoi c'est important de venir détendre le scalène du milieu.
Okay, so I almost need a chair or some little. Can we grab that chair? Okay, let's move this table just back a little bit. Okay. Just put the chair. I'll put the chair there. Put the chair here. Now this is quite an important procedure for you, because any of your patients that have any type of radiculopathy, any type of radicular pain, any type of referred pain going from the neck region, not just to the shoulder, but also down to the elbow. You guys, can you guys go to the back? Just for now, sorry, because I can't. Okay. So anybody that has any referred pain going into the elbow or down to the wrist or into the hands, or numbness, or paresthesia, anything like that, very often there will be some compression at the thoracic outlet in this area. And when you do this one procedure on a patient with a thoracic outlet syndrome or anything like that, okay, when you do this one procedure, it is unbelievable the help that you can give that patient with that radicular condition. So this is not just for shoulders, this is also for any type of neurological compression. That being said, obviously the exiting the nerves where they exit out through the intervertebral foramina, through the holes from between the bones, in that area of the cervical spine and the neck, that is also going to be a potential source of compression. So these are the two main sources of compression. But this one will be often responsible primarily for radicular symptoms going into the shoulder, elbow, wrist, and hand, and also potentially causing muscular weakness in the muscles of the upper arm and lower arm and hand. So this procedure is a really big one for you. Okay, now what we're going to do is we're going to keep the head neutral in terms of rotation, but we're going to laterally flex the neck in the opposite direction of the side that is shortened. Okay, in his case, it's the left side, so I'm going this way, okay?
Ici, on fait le TL du scalène du milieu.
Let's move over a bit this way here. Maybe you should explain to them in French what I just explained to you very quickly about the radicular.
Yeah, okay. So, c'est un peu comme je disais, souvent quand il va y avoir des douleurs, des symptômes de douleur référés vers le bas, des symptômes d'engourdissement, des symptômes neurologiques. Oui, des fois, ça peut être la vertèbre qui vient coter sur le nerf, mais très souvent, ça va être le scalène du milieu qui vient compresser dessus. Donc, c'est une procédure qui peut faire une grosse différence là-dessus. C'est peut-être la première affaire, puis très souvent, on va avoir une réduction des symptômes.
Comprenez-vous?
Oui.
Okay. Now, what we're going to do is you're going to come this way as you breathe out, when I tell you. And now what I'm doing here is I'm coming completely under the neck with my hands so that my thumb is pointing directly upward toward the ceiling, right beside the lower insertion point of the middle scalene. Okay? So my thumb is coming straight up. I'm going completely under the neck with all the rest of my hand. The thumb is coming straight up from underneath. And what I'm going to do is keep his head neutral, bring the ear, opposite ear to the opposite shoulder, so it's lateral flexion. Okay? And then I'm going to, with this hand, I'm going to depress the shoulder here, which will immediately put pressure on this area. Should you be explaining as we go?
Yeah, I think so. Alors, dans le fond, ce qu'on va faire, flexion latérale du côté opposé. Comme ça, sa main est en arrière de mon cou pour venir se glisser puis attraper son PDM. L'autre main va venir faire une dépression de l'épaule pour augmenter le stress qu'il va avoir sur le scalène du milieu. Puis après ça, on va se préparer à faire notre contraction de TL qui va être à 80% de la force du client.
So remember, keep that chin pointing up toward. Don't allow any rotation. It'll really spoil the procedure.
Voilà, faut garder la tête neutre. Bien important.
Here, this puts pressure already. See. And then the fleshy part of the forearm on the zygomatic arch of the mandible of the face. Okay. You have to explain that.
Okay.
So the
Donc
fleshy part.
la portion un petit peu plus moelleuse de l'avant-bras qui va s'appuyer sur l'arche zygomatique.
Okay. So what he's going to do is he's going to just try to only laterally flex his head. So it's important to tell the patient not to rotate their head. Laterally flex, bringing the ear to the shoulder of the side that we're treating.
Le patient va faire une flexion latérale du côté gauche, amener son oreille vers l'épaule. C'est important de ne pas faire de rotation. Il faut le surveiller, il faut bien le coacher, parce que si on fait une rotation, on perd de l'efficacité.
And breathing. And go. Now what I'm doing with my thumb is I'm driving my thumb straight up toward the ceiling as hard as I can and relax it. And then I will push this way and also, and I'll have to sometimes do it this way. Now, after I finish contracting, I'll slide my hand up here and then lengthen it this way. And then I'll go back and reposition for the next PDM. So watch. So just explain. So I'm taking from here, I'm sliding my hand to the occiput and repositioning to keep everything in line here and to elongate the muscle, and then I'll reposition and take it.
I can't translate since I'm not seeing, so
okay.
so unfortunately, but we'll do it in small groups later.
Breathing, and go, and relax. You see, like that.
Il se replace comme ça pour aller un petit peu plus loin.
And that will really lengthen that middle scalene quite a bit.
Et là,
Okay?
on a-
If I'm doing it on the other side, I'm stronger, I'm a little bit stronger on this side because that shoulder is so weak. Breathing. Sometimes I use my body. And relax. So I'm using here and here, with my whole body in there. Breathing, and go, hard. 6 seconds, and relax. Okay? That is going to open up that thoracic outlet, elongate that middle scalene, and alleviate a lot of the symptoms that can be going into the shoulder, elbow, wrist, and including helping with increasing muscular strength where it's weak, restoring feeling, eliminating numbness, all of those kinds of problems, or helping to alleviate pain that's being referred from the thoracic outlet down.
Une grosse influence sur tous les symptômes d'alourdissement du thoracic outlet syndrome, syndrome de défilé thoracique. Défilé thoracique, merci mes amis.
And then this is also obviously going to help the shoulder that you're working on,
Effectivement, ça va aider votre
which is what you're doing. Okay, so any questions? No?
There's no
That does what?
TS, it's never.
Yeah, there is, but I'm not going to teach the stuff that we do 10% of the time. I'm going to teach the stuff we do 90% of the time. Don't you have enough already in your head? You need.
I'm just wondering if
Yeah?
some case happens.
Yeah. There's TS too. I'll show you the TS if you want. Lie down here. No, the TS is good. The TS, when you check the scalene, usually the TS will be more for anterior scalene. So we'll tilt the head in the opposite direction, contralaterally rotate, flex, hold it here, drive through the cornu of the forehead, push. And if it's weak, and if it is weak, then usually breathing, and TS will be something like this. You're going to come down and rotate back to the same side. Breathing, go. Breathing, and go. And for the middle scalene, it will be simply just relax here. Breathing, and go. Super simple. That way. But usually it's more TS for weakness of anterior scalene, and usually more TL for shortness of middle scalene.
If there's radiculopathy, you have to do it bilateral or on just...
If there's radiculopathy, what?
If there's radiculopathy, you have to do it both sides, right and left, or only...
Well, no, if there's only radiculopathy on one side, then you just do the one side that's short. Okay.